Hi, I'm Michelle Sterling for Friends of Science Society. Have you been to the doctor lately? Did they give you a Parks prescription? You know, where they actually write down on a prescription that you should go and spend about 2 hours a week in a park, 20 minutes at a time. Now, in principle, I'm not opposed to a Parks prescription, that's P-A-R-X, but I do have some questions about why it's happening now. You know, there's a shortage of healthcare workers. The medical system across Canada and most places in the world is really stressed. So the thinking behind this is that it actually reduces the load on healthcare because there are health benefits for being outside. Just taking a break from our screens is a very good thing to do. Going for a walk. Maybe you can't walk very far, you can just sit on a bench and enjoy nature, if you don't have seasonal asthma, that is. But the thing that I find a bit concerning about it, and one of the things we're tracking all the time here at Friends of Science is, you know, net zero healthcare. Yeah, net zero healthcare is a real thing. The healthcare communities around the world at COP26 in Glasgow signed on to a commitment to try and cut healthcare emissions in half by 2030. So if you're in a long wait list, you might wonder if that's the reason. Because if there's no patients, there's no emissions. And I think there's also another side of the Parks prescription that bothers me. It's a program that's set up and originated with Dr. Melissa Lem. She's part of the Canadian Association for Physicians for the Environment. They've been very active lately trying to stomp out fossil fuel advertising and stop greenwashing by oil companies as to the benefits of oil and gas. You know, the thing is, modern medicine relies entirely on the energy from oil, gas, and coal, and all of the product stream from it too, all the sterile plastics, all the special therapeutic and diagnostic equipment in a hospital. That can't be made from wind and solar power. So they're kind of cutting off their nose to spite their face. The person who's going to suffer is you. Another concerning aspect about healthcare, and this is on a slightly different topic, but as part of the net zero commitment, they're now actually measuring the frailty of a person's condition, especially in the elderly. You know, because as people age, they generally do require more medical care, and many develop chronic conditions that require a lot of resources. So you know what happens when you start thinking that people are using up too much energy, or that they're just a useless eater. Yeah, that can lead to very bad policies in a country. And we've seen it in the past in pre-war Germany. So I think if you look at Michael Crichton's book, State of Fear, you'll find an essay in there that relates to that time in Germany. And unfortunately, there are some parallels to what's happening now in Canada, in medicine, with net zero healthcare policies, long wait lists, and the push for MAID, medical assistance in dying. These are things to think about, and a lot of them are related to climate change and the push for depopulation, the push for cutting energy use in half by 2030. Just imagine your hospital or medical clinic running on half the energy it uses today in the next 6 years. Think about it. For Friends of Science Society, I'm Michelle Sterling.